For months, a hepatitis A outbreak has been described in terms of homeless and drug-addicted victims in San Diego. New information this week from local, state and federal health officials shows a much broader geographic scope that is not limited by socioeconomic boundaries. On Tuesday, Sacramento authorities urged recent patrons Haggis Oaks Golf Course to immediately ask their doctors about taking the post-exposure hepatitis A vaccination after an employee of a restaurant at the course was confirmed infected. Also on Tuesday, San Diego officials reported the local confirmed victim count had reached 418, with 70% requiring hospitalization and 17 having died. 2/3 of the sick in San Diego are designated homeless or drug users, meaning 33% of the confirmed victims are not members of those marginalized populations. On Wednesday, San Diego officials reported the state had finally okayed an emergency request they had filed September 20 seeking temporary permission paramedics to be allowed to help vaccinate at-risk vaccinations. About 54,000 people in the county have been vaccinated through emergency programs. Today, epidemic investigators from the Federal Centers for Disease Control and Prevention are scheduled to present research documenting that an outbreak of hepatitis A at a Maricopa County, Arizona, homeless shelter in February this year coincided with the arrival of a person from San Diego. At least 3 samples from the Arizona shelter were molecularly identical to the virus strain in San Diego victims. Restaurant customers must act now. People who ate or drank at Mackenzie's Sports Bar and Grill from September 12 through September 22 should ask their doctors about taking the post-exposure vaccine, Sacramento County Public Health Officer Olivia Casaray said earlier this week. There is only a 2-week window of opportunity after exposure when the vaccine is effective. People who ate and drank at the restaurant are at relatively high risk of infection because it is known that the infected employee handled food. For those who miss the chance for the post-exposure vaccine, it is important to watch for symptoms in the coming weeks, because the incubation time for the virus in humans is 15 to 50 days, according to the CDC. Sacramento officials reported it is not known how the restaurant employee became infected. Numbers increasing despite control measures in April this year, San Diego officials reported they had confirmed 42 hepatitis A cases in the region since November 2016, quadruple the monthly average usually reported. Of those people, 36 had symptoms so severe they required hospitalization. 2 of them died. Efforts in the ensuing months to eradicate the highly contagious virus, which can lead to liver damage and failure, have included cleaning human waste from streets and areas frequented by homeless people and dismantling so-called encampments, where they sleep. Some have been working to increase accessibility to restrooms and hand-washing facilities for the high-risk populations. Other than being vaccinated, public health officials say frequent and thorough hand washing is the most effective way to curb the spread of the hepatitis A virus. On Wednesday, the San Diego City Council's Public Safety and Livable Neighborhoods Committee heard updates on the situation from the city's Assistant Chief Operating Officer and the county's Public Health Officer. Assistant COO Stacy Lomedico told the council committee that street cleaning and increased availability of restrooms and hand-washing facilities would likely need to continue beyond the end of the outbreak. Wednesday evening, San Diego County Emergency Medical Service Director Dr. Christy Koenig told the Union-Tribune newspaper she had finally received email confirmation from state officials on Tuesday, granting a temporary expansion of state law to allow paramedics to administer emergency vaccinations to at-risk populations. With a temporary measure, paramedics will be able to perform hepatitis A vaccinations under the supervision of nurses at special events created to inoculate those who are at high risk of infection. Getting the state to approve the request took a fair bit of back and forth with California regulators, according to the San Diego Union-Tribune. Assemblyman Todd Gloria, D. San Diego, added a letter of his own, urging approval on September 27. Brutal, bitter irony this week. In a twist of fate straight out of a Hollywood disaster movie, infectious disease experts from across the country are gathered at the San Diego Convention Center for ID Week, an annual scientific conference of the Infectious Diseases Society of America. San Diego County's Director of Epidemiology and Immunization Dr. Eric McDonald joined with one of the CDC's epidemiologists, Dr. Monique Foster, to discuss the ongoing hepatitis A outbreak, and the virus in general. Public health officials like McDonald and Foster have been watching the virus make huge increases in